Why is it important to be aggressive with treating pain early on? And the reason is we want to prevent the development of chronic pain. So let's talk about that. So let's say you've had a surgery, which you'll notice is oftentimes, especially with orthopedic surgeries, we're loading people up with medications like gabapentin and Tylenol and anti-inflammatories the night before. We're much more about regional anesthesia and placing a block or numbing that area to be operated on. And then we're trying to get you as active as possible after the procedure. And the reason is that when it comes to pain pathways, if you allow pain to persist for too long, it can develop into chronic pain. And what chronic pain is it's the development of neuroplastic changes that does three things. The pain threshold lowers, it fires more intensely, and it fires for longer. And the three factors that contribute to this are how intense was the initial pain, how long did it go on for, and what kind of repetitive issues was happening. So if you have a surgery that was extremely painful and they didn't control it, if they didn't control it for a long time, and then you had to go in for repeat procedures or something else and it was happening on a repetitious basis, then you have a high chance of developing chronic pain, as opposed to if you controlled that pain in that initial area as much as possible, then the chances go down quite significantly. So if you have a situation where you're in a really bad, painful situation, let's say you have a herniated disc, you aren't getting better, nobody's treating it, you're not getting relief, find a pain physician so that they can aggressively intervene and make sure that you don't develop chronic pain. Hopefully you find this helpful. If you want to learn more, click the link below.